My diagnosis is called cholangiocarcinoma, otherwise known as bile duct cancer. 3 out of 100,000 people per year get diagnosed with this, making it very rare. In the area of financial, I had just started a brand new job and had to quit after a few weeks due to impending surgery and subsequent chemo. I had paid into the short-term disability and long-term disability programs for 24 years as an occupational therapist. And unfortunately, because I just started a brand new job, they told me, gee, we're awful sorry, we can't help you because there's a 12-month pre-existing clause. So I've been out of work for almost a year. I could have gotten 60% of my salary while I was battling this. I have not been able to work due to being an occupational therapist, being around infectious diseases, and the oncologist said absolutely not. Another thing that was very difficult for us is that I had to battle with my insurance company for more than a couple of months because they were telling me they weren't going to pay for my chemo because they said it was just a pill instead of an infusion. And they didn't believe it was chemo, despite the fact that the doctors wrote letters on my behalf. Eventually, we were able to get help with this through the Cancer Copayment Assistance Program, and thank God for them. Otherwise, I would have had to pay $2,400 a month for my chemo. All of the above resulted in now living off of credit. I should be looking at the age of 53 towards retirement. Instead, we're living paycheck to paycheck and in debt. I was blessed enough to receive Social Security disability and had no fight because it's considered a terminal cancer diagnosis, so they put it right through. So that was wonderful, but also terrifying, knowing that that's how serious they take this disease. I've had 24 wonderful years as an occupational therapist paying into the Social Security system. I'm very grateful to be getting something. However, it's about 1/5 of what I normally make, and therefore not enough to live off of. My prognosis is poor, so I would like to work on a bucket list, but unfortunately unable to afford to do that. So now I'm left with, do I work or should I work on my quality of life?
His infusions can range anywhere from $8,000 to $12,000 a month, so 5 months worth of no pay by insurance was pretty alarming. Sadly, though, because it took some time to rectify all that, Tom stopped treatment because he was so concerned that what if they're right? What if we're doing this out of network? And I can't sit for 4 to 6 hours with this going through my arm, knowing it might be costing $15,000. So he stopped treatment for a few months, and at that time we switched to a local Williamsburg doctor that we had verification, an actual letter saying he was in network, and Tom began seeing him.
It was one of the most stressful things I've ever been through. It just felt so strange. I mean, how can, we went did all this preliminary work to find a doctor that was recommended and had it, went to the clinic every month and had no warning, no inkling that something like this could happen. It was a tough decision not to get treatment, but it's just like I didn't want to bankrupt myself. It's a tough choice to have to decide whether you want to get treatment. Either you want to have die financially or die physically.
I said, what does it cost to have cancer? And she said, well, if nothing goes wrong, about $75,000. Okay, that was kind of hurtful, but I could live with it, I guess. And I still had 2 kids in college and a 9-year-old. And finally, my oncologist said, would you please shut up about your insurance, because I don't want my decisions based on money. I want to give you the best care possible. Anyway, I went through chemo, surgery, radiation, and somewhere along the line I found Patient Advocate Foundation, thank God, and just a lot of people helped. People that I didn't even know helped. I'm standing here by the grace of God and the kindness of strangers, and thank you so much, everybody in this room, for what you've done. I finally got brave at the end, and I totaled up just the medical bills, not the pharmacy bills and all the other things, and it was $172,000, and I was healthy. They told me at the oncologist, they said, you have the best blood counts we've ever seen, and it was $172,000. So I would have ended up with a $147,000 debt hanging over my head.
Through the years, my role as a family caregiver has been a financial strain. For example, during a 9-month period in 2017, I went without 1/3 of my yearly income due to unpaid time away from work. I have declared bankruptcy in the past. I wasn't able to afford unpaid time away from work, keep a roof over our head, buy groceries, pay our utilities, and other necessary expenses along the way. Unfortunately, my family story is not uncommon. My volunteer work with the Patient Advocate Foundation, National Patient Advocate Foundation, has helped me find resources and assistance with the thousands of patients and families that I have talked with through the years. Through my interaction with patients and families, I realize so many desperately need a voice to be heard.
But one of the things that I really want to share with you is that sometimes I can look into his eyes and I see the pain, not so much to be a bilateral amputee, not so much to be an end-stage renal patient getting dialysis 3 times, not so much to be a diabetic for 40 years, not so much to be a patient with Crohn's for even more, and not so much to be diagnosed in 2011 with polymyositis, a rare neurological disease. But I look into his eyes and I see the pain of not being that 6-feet man in splendor who spent 50 years at the Peabody as a supervisor of the Ducks. I see that and I say, oh, if only I could change, but I can't change it.
I'm waiting for my son to pick me up at the airport. An unknown caller tells me to meet my son at the hospital. I go there quickly. He was in a wreck. The police tell me it's a miracle he survived. He's conscious but not himself. He has a traumatic brain injury. Unbelievable. His symptoms get worse slowly over time. He has to be put in an assisted living home. He doesn't want to burden me. It takes too long to find a home for him. He chooses to be homeless. I find a rehab center where brain injury is accepted. We have to drive 2 states, and we need $30,000. I mortgage our home. Still no income. On day 3, the treatment center calls to tell me they can't accommodate his brain symptoms. So they discharge him and tell me he's on the streets without his belongings. He needs to see a psychiatrist, but I can't find one who takes Medicaid. I find out it's $400 to visit the psych doctor. My son visits her. She prescribes medicine. His symptoms change but do not improve. She needs to see him again, $400. New meds. He collapses while working out. We race to the ER, and he is admitted. A week later, he leaves the hospital with a new diagnosis, schizophrenia. Unaided, I figure out how to navigate public resources for him. He stabilizes and commits to wellness. He learns to cope with the symptoms. We know it's forever. So what have I learned? Compassion is sacred, and fate is an excellent teacher. Caregivers sacrifice their health and well-being volunteering within a system that does not support them.
The fact that I was waking up in the morning was amazing to me. I was really sick, and I ignored it for a really long time because my brother died. My sister had a brain tumor. My daughter was diagnosed with epilepsy. And I could still walk and talk and cook and clean, so I was still useful to my family, so I ignored lots of things. But when we're talking about healthcare legislation and policy and bringing a voice to advocacy, as far as having a dialogue with legislators, the last rule on this list says, remember the Dick and Jane books and the first word you learned. The biggest word of all, look, right? I would urge our congressional leaders to actually do that because they hear a lot, right? But what they really need to do is look. Because sometimes the warriors are the wounded.